Folks, without further ado, welcome to the WDG Public Health Parent and Caregiver Information Session on Cannabis and Other Drugs. My name is Danny Williamson. I'm part of the communications team here at Public Health. We're going to have Dr. Matthew Tenenbaum, who's the Associate Medical Officer of Health, give a presentation this evening, and then we'll move on to questions both that we've received in advance, as well as any questions you have as we go along. What we'll do, the session is divided roughly in two. We'll have about 20 minutes of presentation, and then we will move along to the Q&A. And as we begin, next slide, please. I wanted to acknowledge that the work of Wellington Dufferin Guelph Public Health operates on the traditional lands and home of the Haudenosaunee, Anishinaabeg, Tiantati, and Attawandaron people, and is steeped in the tradition of many First Nations, Inuit, and Métis people. As an agency, we encourage our staff, partners, and clients to support the work of reconciliation and promote healing with our Indigenous neighbors. We are also committed to reducing social inequities. We'll strive to make our services culturally appropriate and safe for all Indigenous people, their families, and their community. Just a couple of items of note tonight in terms of housekeeping. Your cameras have been disabled, so it'll just be me and Dr. Tenenbaum, who you'll be able to see this evening. The links to any resources we talk about will appear. You'll be able to see it down at the bottom of the screen in the box labeled chat. So any websites, any other resources we bring up, we'll make mention of there. If you want to ask a question, you'll see the Q&A, the two little speech bubbles side by side, also down there at the bottom. We've got a team working behind the scenes tonight, so those moderators will see your questions, and they will feed them over to me so that we can make sure that we answer as many as we possibly can. We typically get quite a number of questions at these things, so we'll absolutely do our best to get them all answered, though we don't always. So we will do our very best to keep that on track and keep as many questions coming in as we can. So you know, once questions are answered, your question and username will appear to all participants. If you would prefer that your name does not appear, you can check the anonymous option in the Q&A section, and that will keep your question anonymous. This webinar is being recorded. You just saw the notification. And will, when it's ready, be available on our website, wdgpublichealth.ca/youth substance use. That usually takes us a couple of days, but you'll see it all over social media and beyond as we make it ready. Tonight, the purpose of the session this evening is to do a couple of things. One is to inform parents and caregivers of youth about the impacts and harms of cannabis, prescription pain pills, and cough and cold medicine. And then to share some strategies and resources that parents and caregivers can use to help navigate substance use among youth. So really what we want to do, folks, is give you a few strategies and some information to help you have those conversations with youth in your life. So tonight, what we'll do by way of an agenda, we're going to start off talking about cannabis. We'll move on to other drugs, so prescription pain pills, cough or cold medicine. We'll put some of that in a local and provincial context. We'll provide some resources and some thoughts about talking to youth about drugs, and then we'll move on to that Q&A period that I mentioned. So all of that being done by way of housekeeping, agendas, and order, all that I have left to do is to introduce Dr. Matthew Tenenbaum, who's the Associate Medical Officer of Health. In this role, Dr. Tenenbaum provides oversight, support, and medical expertise to staff and community partners. And prior to joining us here at Public Health, Dr. Tenenbaum worked for several years as a family physician in Hamilton. He completed his residency in public health and preventative medicine at McMaster University, during which time he spent time at several health units in Southern Ontario, including this one. Dr. Tenenbaum holds a Master of Public Health from the University of Toronto and a medical degree from McMaster University. Dr. Tenenbaum, welcome, and over to you.
Thanks very much, Danny, and good evening, everyone. Thank you for spending some of your evening with us tonight to talk about substance use in youth. And I really appreciate the chance to spend about an hour with you between the presentation we have and the Q's and A's. I really am hoping that as we come out of this hour, we've given you some good information to understand the issue and to engage in conversations, and also some very practical tips or strategies that you can use to take that information and translate it into action within your family, your household, whatever context you are in, engaging with young people who might be using or you might be concerned about using substances. So I'll begin by talking a little bit about what the substances are that we know young people are using in our community. And I'll begin by speaking about cannabis. So cannabis is a substance that you've probably heard of in the past. You may have heard of it referred to under a different name, like marijuana, weed, or pot. There are a whole bunch of terms for this substance, and it really is a substance that goes back millennia. People were using it at least as early as about 2800 BCE, and many different civilizations and cultures historically have used it, in part because they believed it had potentially healing properties, because of the effect it has on the mind. The contents of cannabis are psychoactive, and that is part of the reason why people are interested in using it to this day. Cannabis as a drug comes from a plant called Cannabis sativa, and that produces leaves and flowers and other components that can be harvested and dried. And historically, that dried cannabis has been lit so people can smoke it and otherwise consume it by using that part of the plant. That plant contains a whole host of chemicals, including a really important one called THC, and that's the important piece of cannabis that produces the intoxication or high people get when they consume it. And what it does is it interacts with receptors in someone's brain to produce that feeling. Historically, cannabis is a drug that was illegal across Canada, and it has sometimes been a particular focus of the so-called war on drugs and some of the efforts across society to reduce or counter drug use. However, it was legalized in 2018, just over 5 years ago. And in Ontario, people 19 years and older can purchase, possess, or share a certain quantity of cannabis, though it does remain illegal for people under age 19 in Ontario. In terms of how people use cannabis, there are really two main ways. You can either inhale it or breathe it in, or you can ingest it, meaning eat it. Since these have different ways of delivering that THC chemical to someone's brain, these two ways have very different effects on a person's experience when they use it. When someone inhales cannabis through their lungs, it is immediately absorbed in their blood, it's rapidly delivered to their brain, and the person who's using it can begin to feel some of those effects from cannabis within a few minutes. And as a consequence, what typically happens is that person, if they're smoking it or vaping it, they can adjust how much they're consuming of that cannabis based upon how they're feeling, because they're getting that immediate feedback of the effect it's having on them. The other major way that people use cannabis is by ingesting it or eating it, for example, in the context of an edible, like a pot brownie or something like that. And when that happens, of course, it goes down to your stomach and it's gradually absorbed in your gut. And as a consequence, it hits the brain through a much slower process. And someone might eat that brownie and then not for several hours feel any effects. And what that means is that when it hits you, it can be a bit of a surprise. It can hit you all at once, and you lose that ability to adjust how much you're consuming based upon how you're feeling, because it really is later that it hits you. As a consequence, there's a significantly higher risk when you're ingesting or eating cannabis that you are going to overconsume because you lose that feedback mechanism. Now, alongside that, there are a whole bunch of different products, and you can even talk about further ways of breaking down how people use it. Of course, in terms of inhaling it, you can smoke it in the context of a joint or a bong or something like that. And you can also actually find cannabis in vaping or e-fluids that people are consuming through e-cigarettes or vape products. Some of those have cannabis added. And there are even ways of inhaling it through heating oil or wax, and you'll sometimes hear that called dabbing. In terms of how you can ingest it or eat it, you can, of course, consume a cannabis edible or take it in through what's called a tincture, where cannabis is suspended in a liquid or fluid. And there are even different kinds of creams or ointments or suppositories that are becoming available that people can use to absorb it through their skin, for example, and get their high that way. There are a whole bunch of different ways people use it. And they vary widely in terms of how much of that THC chemical they might contain, and also how potent that THC is and how it affects the human body. We do know that looking at Ontario data, the most common way people consume it, if they're youth, is that they are vaping it or they're smoking it as a joint. About 1 in 6 people who use cannabis consume it that way. Second or third is eating edibles. So that's about 1 in 8 or 12% of people consume it. So all of these are important contributors, but certainly smoking, vaping, and eating are the most common ways people get their cannabis. Now, there are, of course, reasons we're talking about cannabis with you tonight, and that's because while they can produce highs and positive effects for people who use it, they also carry certain harms and risks that people ought to be knowing about. And when I think about it, I find it helpful to talk about some of the harms or risks, both in terms of a short term and a long term. In the short term, it's important to remember that cannabis is psychoactive, it affects the brain, and as a consequence, it can affect someone's alertness, focus, and coordination. And just like something like alcohol, it can be very dangerous if you are intoxicated with cannabis to do things like driving a car or engaging in other higher risk activities that really do require your full attention. And in the same way that driving under the influence is a concern with alcohol, things like that are a concern with cannabis. Additionally, cannabis can affect someone's memory, judgment, and decision-making while they're high or while they're intoxicated. So it can be harder for them to do work or engage in schoolwork, to function to their fullest ability while they are intoxicated. And that can have consequences for them later on in life as well, based upon the impact it has on their performance today. And of course, while cannabis can produce positive feelings in people, like making them feel more relaxed or giving them a high, it can also cause negative symptoms like feeling panicked or anxious or paranoid. And when it comes to some of these effects, some people are at greater risk of experiencing than others. People have different levels and ways they respond to cannabis chemically in their brains. And so the mix of feelings someone will have is very specific to them and is difficult to predict across people in general. When we think about the fact that people might be using cannabis regularly over long time periods, that carries its own concerns or risks. Of course, if you're smoking or inhaling cannabis, you're inhaling the cannabis and other things that are with it in the vape fluid or the joint that can cause damage to the lungs in ways that are similar to tobacco cigarettes or e-cigarettes. People who use it regularly are at higher risk of developing addiction or dependence. And as a consequence, that means that their need for cannabis can interfere with their ability to function in other parts of their life. And we also know from emerging evidence that consuming cannabis regularly can increase a person's longer-term risk for developing mental health problems, things like anxiety, depression, or psychosis, which is a condition where a person has difficulty interacting and recognizing reality around them. We know, for example, from a recent study in Ontario that people who had to go to the emergency department because of their cannabis use, they had about a 4 times higher risk of developing an anxiety disorder within the next 3 years, and about a quarter of them did. So that's not an insignificant change in their risk, and it does speak to the fact that there's a long-term consequence to regular use with cannabis. And we know that cannabis is a particular concern when it comes to young people. Adolescence or being a teenager or being a youth, that's a sensitive time for brain development where your brain is rapidly changing in its structure and function. And it doesn't really finish that development until about age 25 or so. Until that point in time, your brain is still maturing and developing. And the THC in cannabis, as I mentioned, it acts on the brain, and regular exposure of the brain to THC can alter the process it undergoes as it develops and put people at greater risk of developing cognitive difficulties around things like memory, learning, or problem solving, or other mental health problems later in life. The risk is highest for those who are youngest, and it seems to be that those who use higher amounts or use more frequently are also at greater risk. And in particular, we know that people who begin to use their cannabis before age 16 are at higher risk for some of those cognitive impacts that we want to avoid. Now, we're talking a lot about youth, and that's a time period, as I mentioned, where the brain is quite sensitive, but it's also an important time socially for people as they're growing up. It's a time when people are developing a sense of independence, and it isn't uncommon for youth to think about other kinds of experimentation or risk-taking behavior. Cannabis is one of those things that they might be experimenting with, but that doesn't exist in a vacuum. And there are other substances people might be enjoying or other risk activities they might be participating in. We know that people sometimes do mix cannabis with other things they're consuming. For example, from our local cannabis survey we did last year, we found that about 1 in 4 people aged 16 to 24 reported that they always or sometimes, always or often rather, use their cannabis with alcohol. And of course, those things in combination can really amplify the intoxicating effects of both. Another 1 person in 4 said that they always or often used cannabis in combination with tobacco or e-cigarettes. And that poses risks of addiction to those products, and of course, some of the things like damage to the lungs that I mentioned earlier. And as I mentioned earlier, cannabis can make activities like driving unsafe, and that's true whether it's used on its own or used in combination with other things like alcohol. The key thing is that when you're under the influence of these substances, you aren't fully attentive, you're not able to respond to external events as quickly, and that makes these activities, which always carry a risk, into a particularly high-risk activity. Now, as I mentioned earlier, cannabis was legalized in Canada in 2018, and in Ontario, that's specifically for people aged 19 years and older. Now, this was part of a public health response to cannabis, and this change helped to reduce some of the harms that existed in our society that existed because people were only accessing cannabis illegally or through a street supply. And that includes harms related to people's interactions with the criminal justice system. However, that legalization also changed the ways in which we as a society interact with and consume cannabis. Since legalization in 2018, we have seen a wider variety of cannabis products that have become readily available. Like I mentioned earlier, there's things like dried flowers, edibles, beverages, tinctures, topicals, vape products. The variety available to people to choose to use cannabis in the way they prefer has really expanded. And as well, people now have easier access to cannabis through a whole bunch of legal sources, like storefront dispensaries or online through things like the Ontario Cannabis Store. And really, that ease of access is one of the factors people have told us is behind their decision to use or use more since legalization. The cannabis that's available today is also quite different than the cannabis that may have been available decades ago. The THC content is often much higher. And that is, again, the chemical that causes the psychoactive effects of cannabis. Just to put as an example, so dried cannabis that's typically smoked in the 1980s contains an average of 3% THC, but now the average is about 15%. And there are some products that go as high as 30% or higher. And in some ways, the potency or concentration of THC has been used as a selling point or a way to appeal to people who want to chase a certain kind of high. And we are concerned that the cannabis that people are using today is much stronger than the cannabis that existed not even that long ago. We've also seen an increase in cannabis-related emergency visits for adults around things like agitation or anxiety episodes or vomiting episodes, but in particular for psychosis that has been induced by cannabis. We've also seen hospitalizations of children who are unfortunately going to hospital because of unintentional cannabis poisoning, since the legal availability of edible products. The idea is that children, unfortunately, in their homes or in other places, are inadvertently eating these edibles that contain cannabis. Of course, a pot brownie and a regular brownie are going to look identical. And it's that lack of safe storage that leads to this happening. And unfortunately, that can result in a very high dose delivered to that young child, leading to a medical problem for them going to hospital. And that speaks to the real importance of keeping cannabis edibles and really all forms of cannabis that might exist in your home out of reach of children and in safe places. I'm going to change gears for a moment and speak a little bit about another substance that we know youth use in our community. I'm going to speak about opioids. So opioids are a class of drug derived from the plant opium, and it can be highly addictive. You might have heard of opioids before in the context of the broader drug poisoning crisis that our community's been experiencing for a number of years now. And when you hear the word opioid, you might be thinking of things like heroin or fentanyl that you may have heard are circulating in the illicit supply in our community. However, opioids are also a drug that are available in the form of a prescription medication. Things like Tylenol 3 or Percocet are examples. These are really strong pain relievers, and they can produce a feeling of euphoria when they're used, but they also carry certain kinds of risks, even when they're prescribed. These drugs, they are, they are drugs that are used medically. And when they are appropriately prescribed and used and monitored, they are safe and effective. And they really do help people who are suffering from things like chronic pain or other problems that are appropriate for an opioid medication. However, what can happen sometimes is that these drugs that are prescribed appropriately can be misused by a person who's prescribed them, not taken as prescribed, or they can be used by someone else who it wasn't prescribed to and who doesn't have that chronic pain or other issue that needs an opioid. But those people might be interested in using it recreationally, seeing what the high is when you use it. And unfortunately, they may develop harms in the short term or go on to develop addictions as a consequence of their youth. And so we know that young people, youth, may be able to find medications like these in their homes. If you have someone who's been prescribed an opioid pain medication and it's sitting in a medicine cabinet or somewhere else, that is a way that people who aren't prescribed them, like youth, can get access to them. And we also know that it's not only that context, but they can get them from friends or family members at school or in other places if they're being shared. These are things that are out in the community, and people can get access to them, even if they're not being prescribed to those people. What's perhaps most concerning to us is the prospect that youth could access versions of these medications that are actually counterfeit, and they are part of the unregulated drug supply in the community. Unfortunately, those could be contaminated with more potent opioids like fentanyl or other substances that can really put them at risk of having an overdose or dying as a consequence of using it. In the context of opioids and overdoses, there is a medication called naloxone, which you may have already heard about and which we talk a lot about in public health. And its job is to temporarily reverse the effect of an opioid someone's taken. So if you take a high dose of opioids or you have a really potent opioid you're exposed to, it's toxic in your body. And what it can do is it can cause you to become very drowsy, cause your breathing to slow down. And if it's a high enough dose, can actually cause your breathing to stop. And that's what can kill you in the context of an overdose. If someone is experiencing an overdose, giving them naloxone can actually keep them alive and save their life by keeping them breathing. It blocks the effect of opioids and ensures that they don't stop breathing after using an opioid. It usually comes in the form of a nasal spray in a kit that really anyone can be trained to administer. And once administered, it works within minutes. And you can actually get naloxone for free from us at WDG Public Health at our offices or from many pharmacies in our community. Having it is a particularly good idea if you know or suspect that someone in your home or in your life is using opioids, because this is something which, again, in an emergency, can save a life. If you get a kit, whether it's from us or a pharmacy, alongside that kit, you'll also be trained on how to recognize what an overdose looks like and how to administer the naloxone dose that you're being given. And really, what you should do is keep that naloxone kit with other first aid supplies in your home so that you have it available as part of an urgent first aid response alongside calling 911. The third topic I want to talk about in terms of the kinds of drugs people use are cough and cold medicines. And you might be wondering, why is Dr. Tenenbaum talking about cough and cold medicines? They're over the counter oftentimes. They're really not things we think about as being worrisome or concerning. And usually we think about them as being pretty benign. We give them to kids. We don't prescribe them. They're over the counter. But they do contain ingredients that can produce concerning effects, intoxicating effects. They do often contain codeine or other opioids in some quantity. We spoke a moment ago about opioids and what kinds of effects they can cause. They may also contain other chemicals, for example, something called dextromethorphan or DXM, which is used as a cough suppressant. It can, if it's given in a high enough dose, cause drowsiness and hallucinations and other concerning side effects. And like cannabis and opioids, it acts on the brain and with receptors there. And we do know in terms of how it's being used that young people are, for example, taking large quantities of cough syrup and mixing it in combination with things like pop and hard candy to create beverages they can drink. There's one that's called purple drink or lean that people make by consuming cough medicine with these other sugary drinks. And that can make it easier to consume, more appealing to consume, particularly in a social context like at a party. And the key thing here is that a cough medicine, when you're taking a dose as recommended on the label, which is a small dose, it can be safe and appropriate, particularly if you have a cough. But the concern we have is from how these things are being used when they're being used in particularly high quantities, because in order to get that desirable hallucination that a young person might be after, you do have to really take it at a dose in a quantity that is unsafe. And it is the dose people take that makes it toxic. Talking a little bit about our local context. So we have a few ways of knowing about what substance use looks like. We have data nationally and provincially, and we also run surveys in our community to understand patterns that may change over time. In our community, we do an annual survey for young people administered through schools. And one of the things we ask about is their substance use. And we have focused on cannabis, prescription opioids, and cough medicines in our talk tonight because that survey has told us that those are the things people are using in our community. We are going to be releasing our 2023 survey results later this year. They're just being finalized right now. But we do know that from 2022 data, we saw about 1 in 5 youth reporting that they used drugs within the past year. And that's generally higher as you get into those older grades or older individuals. And it also varies a little bit depending on what substance you're talking about. The most commonly reported one was cannabis. We saw about 1 high school student in 5 reported that they used cannabis in the past year. And about 1 in 10 high school student, grade 9 to 12, reported that they'd used prescription pain pills without a prescription, or they'd used cough medicine for the purposes of getting high. That's obviously not a small number, but it may also not be quite as high as you thought. We are generally seeing that use is higher among female than males, but is highest among those who report that they identify as non-binary, meaning they don't feel like the label of being male or female applies best to them. We also observed some decrease in these numbers since our last survey in 2019 prior to COVID. However, we know that doing a survey in 2022 during COVID and the heat of the pandemic, that might have reflected the different ways young people are interacting. And when we do our data from the most recent survey in 2023, we might see some different patterns emerging. Now, there are a lot of reasons that young people might be using cannabis or other drugs. As I mentioned, when you are in that adolescence phase, you're going through a transition in your life and risk-taking behavior might be more appealing. It's not just about, the chasing a high or trying to produce a good feeling. The key thing is that, using or choosing to use these substances exists within a developmental and social context that young people are experiencing during this phase of their life. Might be looking to these substances as a coping strategy for mental or physical health problems they're experiencing, things like stress, anxiety, or trauma. We know that this phase of life is very stressful and challenging, and in particular now, coming out of our pandemic response, there is a lot of poor mental health among young people in our community that we are trying to address. Of course, peer pressure has always been a factor. People might be interested in trying or using these substances to fit in with their friends or peers. They may have an impression that everyone around them is using cannabis or prescription drugs or cough and cold medicines, even though those things aren't true. They may get a sense that using these things is normal if they see or believe that others in their lives, parents and other adults, are using things like cannabis or alcohol or other drugs. They may strictly be interested in experimenting to see what new experiences they can get, or they may simply be using it for that good feeling to produce things like pleasure or relaxation. The key thing is that it could be any of these or any combination of these that prompt someone to begin using, continue using, or change their use. And really, these are reflections of the phase of life young people are in. And that's why it's a particular high risk period, not just for the harm, but for using these things at all. Now, as a parent or someone else who cares for a young person in your life, really the most important thing you can do is to have a conversation with that young person that will hopefully set them up to make healthier and more informed decisions. We know that by the time kids are 10 or 11, they've already heard a lot about things like cannabis and other drugs from friends or family or from social media. And they're already beginning to develop questions in their mind about these things and their own sense of what normal looks like or not. So it is a good idea to begin having these conversations earlier than you might otherwise have thought they were appropriate to have, because whenever you think your child is ready or your youth is ready, they are probably ready at some earlier phase. And kids are thinking about these things at younger ages than you might realize, even if they're not talking about them yet. And as a caregiver or a parent, you probably have some insights based upon your family context into how to best approach this conversation. However, what we know from surveys and best practices is that youth are looking for a few things in these conversations when they're having them with an adult in their life. Really, they want to feel like they're being heard and having a conversation without judgment on them. They want to feel like they're able to express their own perspectives on the issue of their use or the use of others around them. And they want to feel like they're receiving a trustworthy and unbiased information. And our goal tonight is to help set you up to be able to deliver on those things. As you prepare for a conversation like this, it is a really good idea to start with getting the facts, which is, again, what we're trying to give you some of tonight. And also to consider your own motivations and fears and values that you might bring to the conversation. So really to reflect on things like, why do I want to have this conversation? How do I, as a parent or a caregiver, feel about drug use? And how does that vary depending on different drugs? Or why do I feel like that's the case? And how might this be a reflection of my own values or own experiences? And also, what kinds of things am I worried about the young person in my life experiencing, and how do I make sure I address those concerns in the way I engage on this issue? So understanding and acknowledging your own feelings and biases that you might bring to the conversation can help you approach that conversation very thoughtfully and deliberately, and to improve your chance of establishing a meaningful connection, just by being really conscious of your own perspectives that you bring in the door. And ideally, as you are, engaging in that conversations, you're seen by your child or the young person you're talking with as being approachable and trustworthy and non-judgmental, and all of those qualities that you see listed on the slide there. In terms of having the conversation itself, you want to begin ideally by finding a time and a place where you both feel comfortable, and perhaps even offering them the opportunity to pick a time or a place for the conversation. Think about how you can do so in a relaxed way where you have enough time and will allow them, the youth in your life, to be frank about their feelings and perspectives. And it is good to be present and mindful about what you say and how you say it in the conversation to continue to promote that feeling of openness and comfort. It's also important to actively listen and to let them speak without being interrupted. You can do things like following up with open-ended questions to show that you're really interested and engaged in what they're saying things like, tell me more about that experience, or asking them, what do you think about this thing that you just told me? And it's okay if that's a little bit awkward, and if there are even periods of silence or pause in that conversation. These are difficult conversations, and having any conversation at all is helpful, even if it feels uncomfortable at first. But the key thing is that you're just showing that you're listening through what you're doing. And as you're thinking about what you're saying, it's worth thinking about how you can be supportive in your responses, really reflect that you understand what they're saying and sharing, and respect the fact that even if you might disagree with the perspective they're sharing, it is a reflection of their reality. And their reality is being a young person in 2024, which may be something they know more about than any of us on this call. It's worth thinking about the feelings and beliefs that they're sharing through the things they choose to tell you, and what that says about their broader experience in life, in school, with their friends, and what stressors they're experiencing more broadly, beyond just the question of drug use. And you can reassure them that your main concern is really about their well-being. And you do want to ideally be open to any questions and be honest about what you do and don't know. Speak with facts, talk about where they come from. And if there are things that you don't know, but you're being asked, acknowledge you don't know, but commit together to finding good quality information to answer questions that they or you have. Finally, as you engage this conversation, don't think of it as a one-off. Consider the fact that these can continue over time. You don't need to cover everything in one go. And really, one of your goals should be to open the door. Use that first conversation as a starting place to build an ongoing relationship and dialogue about substance use, so that the young person in your life will want to come back to you, share their questions, share their feelings, share their experiences. And it gives you the leverage and opportunity to check in periodically, because then you've established that both of you are thinking about this issue and both of you have things to learn from each other. There are a number of great resources out there beyond this slide, resources from groups like Health Canada and the Canadian Centre for Substance Use and Addiction. And they can help provide further guidance and tips about how to engage in this conversation, make it a little bit easier and make it more effective. And we do have links to resources of this sort on our website, wdgpublichealth.ca, under the Youth Substance Use page. Now, as a parent or caregiver, it's very important to know, it's very difficult to know on your own whether or not someone in your life, a young person, is using substances. We have, good evidence saying that a parent or caregiver's impression isn't the most reliable indicator of this, but what you can do is engage in a conversation. The other thing you can do is keep your eyes and ears open for possible warning signs that suggest the youth or young person in your life might be struggling. Things like ignoring responsibilities in their life at home, school, or work, having difficulties in their relationships or interactions with others, abrupt changes in things like their friend group, their sleep habits, their appetite, changing performance in school, or just being more secretive or dishonest or being different with money than they usually are. If you observe any of these signs, it really opens up a good opportunity to have a conversation with that young person in your life. And you should also keep in mind that any of these things, they could be related to drug use, but they could also be signs of other things that adolescents experience, like bullying or peer pressure or problems at school or abuse. And even if these things aren't about drug use, they still can be good triggers for a conversation that can give you better insight into what's going on in that person's life and how you can best support them. If you're concerned about the health and well-being of someone who you care for, who they might be using drugs in a way that's harmful to them or those around them, it is really important to reach out for support. You may have access to a family doctor or another healthcare provider who knows your family context well and who can help connect you with appropriate services. However, we also know that this isn't an option for everyone these days. And there are a number of community services that you can contact, including resources available from the Canadian Mental Health Association in Peel Dufferin and in Waterloo Wellington, as well as the Dufferin Child and Family Services. All of these organizations operate 24/7 contact numbers that you can reach in crisis situations or to access referral to other community services for substance use or mental health. Connects Ontario is a provincial service that can provide information referrals to similar kinds of services. And of course, you can always contact us at WDG Public Health. And if you do, one of our public health nurses will speak with you by phone and help to identify appropriate services that might be beneficial and appropriate for your situation. So this brings us to the end of the prepared part of the presentation. I do know we're going to move on to the Q&A now. I do hope that the information that's here is helpful, and I do also hope that you will ask questions if you have them, whether you had them in advance, whether you developed them during the presentation. We do really want to walk away from this with knowledge about substance use and WDG, but also with practical guidance and strategies about how all of us can best support youth in our community. Thanks very much.
Thanks a lot, Dr. Tenenbaum. Just as we leap into the question period here, folks, I did want to acknowledge, public health has a role, and we play a role within drug use supports and treatment within our community. But those resources on our website, if you're really concerned about immediate harm or the triggers that might have led a young person in your life to seek drugs, there are immediate supports there, whether that's your primary care provider or one of those resources we listed there and that are also listed on our website. And it is really important, and we do want to acknowledge that if it is a situation where immediate supports are required, we really do encourage you to reach out to those and avail yourself of. We do have a lot of really excellent resources within our community, and wanted to make sure that people know that that's the right way to approach that. Dr. Tenenbaum, a lot of questions. We had quite a number that came in advance, so I'm going to start there. And actually, let me check that, because we had a really interesting one that I want to frame up here for you that came in over the course of your presentation. And so the question was, what percentage of students completed the survey, and are those numbers based on self-reporting, and would the numbers be higher? So I know, and I'm gonna tee you up with the number of respondents we had was around 19,000. I wonder if you can say a little bit about, how confident we are in the data, and whether that risk of over-reporting is there, but just maybe how good we feel about that data that we did receive.
Thanks, Dana. That's a great question to speak to how much confidence we have in some of the data that we're sharing or acting based on. So things like the WHY survey, the Wellbeing and Health and Youth survey, which is the one that's distributed through schools that I said data from, that is a voluntary survey. Students don't have to complete it. And so naturally, the data that we get back is going to be reflective of those who choose to use it. And they may not be an unbiased sample of the population. People who choose to respond may be different in meaningful ways than what you get if you had a truly random sample. The fact that we had so many responses does help give us more confidence than we would have if we had fewer responses. So that gives us, at least among those 19,000, some information about their thoughts, attitudes, behaviors, and choices. We can't say it's precise because it's not a random sample, but it is good information we can act on based upon just the magnitude of some of those numbers. It could be off by a little bit, but it's in the ballpark of what we've captured in our survey because we have high response rates.
And Dr. Chandler, we do know that some of the other data sources that we've seen that we have access to, whether it's provincially or nationally, that these numbers do have some consistency. So that gives us a little bit of confidence there as well. Is that right?
Yeah, so there are variations from place to place, but in a lot of our indicators that we follow, we do see similarities with surveys run provincially or nationally. We always do compare against them to understand how our WVG experience might be different than other parts of Canada or Ontario. And that helps provide an additional check to make sure we aren't way off from what we're hearing locally.
Great, thank you. I want to touch base on something that you spoke about earlier in the presentation, and you talked about some of the differences between the varieties of ways that people might consume cannabis, whether that's an edible, whether that's smoking, and so I wonder if you can talk a little bit about the different health risks specifically between, say, vaping cannabis liquids versus sort of that traditional, more kind of dry herb cannabis.
Sure. So I guess two main ways people can inhale cannabis is through like a joint or a bong where they're actually igniting it and smoking it versus using it in a vape fluid that they are vaporizing, which is like a newer phenomenon given that vaping is a newer issue than tobacco use and smoking. If all else was equal, it would probably be safer, all things considered, to vape than to smoke. We know that when you are igniting something and smoking it, you are, consuming a whole lot of chemicals, including chemicals that we know are potentially cancer causing. Vaping, you are also inhaling chemicals, but it's probably a bit of a different risk profile. I have to caveat this a little bit by saying that when it comes to smoking, whether it's smoking tobacco or smoking other things, we just have a lot more time over which we have data to understand the health risks. Vaping is a newer phenomenon about which we're less confident. There probably are fewer things in vape compared to smoking that are harmful, but it's a really low confidence thing I can say. And it truly is if all else is equal. And all else may not be equal because you might be comparing dried cannabis with a potency of 5% or 10% with a vape fluid that contains 20 or 30%. And that would be a very meaningful difference aside from the vape versus smoking question.
And is it fair to say, Dr. Tenenbaum, that while we think maybe one is better, all things being equal, that both of those from a harm reduction perspective, they both have risks. So it's not one is good and one is bad, but that they have different risks associated with them.
Well, both of these and really any of the forms of cannabis use carry the risks of cannabis. And I kind of spoke about those earlier. There's a meaningful difference between inhaling it or breathing it in versus ingesting it or eating it. But there are, regardless of how you use it, harms of cannabis use. And that's an important foundational thing to take away.
Great, thank you. I want to shift gears just a little bit, and I want to talk about you sort of ended talking about how we're going to talk to the young people in our life, and I thought this was a really interesting question that came in from someone beforehand, which is how can I help my child differentiate between prescribed medications and self-medicating with cannabis or other drugs?
That's a really good question. I know that, young people, even like people as young as 10 or 11 or early adolescence, they understand that people take medicines to make themselves feel better. You really understand that as young as being a toddler or a preschooler. And so if as a young person, you know that you're experiencing anxiety and stress and troublesome symptoms that are interfering with your life, in some ways, it's natural to think about prescribed medications as a solution to the problem you're experiencing. It's very understandable that someone might think about the situation that way. What they may not appreciate and what's worth talking about with a young person in your life is just reinforcing that there is decision making that goes into, for example, prescribing someone an opioid. And opioids are a medication which they have risks and benefits. And if someone was prescribed it for their pain condition, it's because the doctor who prescribed it considered that for that person, the benefits were more significant than the risks. But that doesn't apply to everyone. And for someone else, the risks are more significant. And there's a risk of addiction, a risk of acute harm as well. So the key thing is just reinforcing that these things, they're to be used thoughtfully and oftentimes under a medical prescription. And just because you think they are the right thing for you, they may not actually be more beneficial to you than they are harmful. So it is just worth reinforcing that it's about who is that medication for, why is it given, and using them as prescribed. As well, it's worth thinking about, if someone's interested in using it, it's because they have this underlying stressor or challenge or set of symptoms that they're facing. There may be healthier ways to cope or to manage those symptoms, including mental health symptoms. Things like pursuing hobbies or sports or going outdoors and being active are other kinds of things that might be helpful strategies to manage things like stress that are, of course, much, much, much safer than using a medication that wasn't prescribed to you to manage your stress.
That's good. That's great. Thank you so much. Um, I want to move on, and I think this is a related question. But what should I do? What should one of us do if we're worried about the youth in our life and we're worried that they're either experiencing problems with drug use or developing an addiction to cannabis or another substance?
So it really depends on what you're experiencing within your home or family or relationship context. Every situation is different. But certainly, if you are concerned, that ideally should be an opportunity to have a conversation or to continue a conversation you've already begun about substance use in that young person's life. Making sure you have had a frank conversation that gives them information about the harms and the risks of the choices that they're making, empowering them to make choices that hopefully that are healthier and better informed. Sometimes those conversations can be really challenging, in particular if someone's use has gotten to a place where it's having an impact on the family dynamic or other elements of their life. But it can be very difficult to address those things in a family context if you haven't established an understanding of what that person's experience is, what their perspectives are, what their values are, what's informing their decision making. Of course, if you're concerned about the impact it's having on them or those around them, the other piece of the puzzle is to engage an external source of support and help. That's where you might go to your family doctor or the healthcare provider who best understands your family, or access some of those other services I mentioned earlier and which are available on our website. You don't have to do this on your own. Of course, you want all these things to exist on a foundation of a conversation and sharing experiences. But this isn't something that parents or caregivers have to bear as a burden exclusively. Supports exist in our community.
Let me push on that a little bit, because I was a teen, and some amount of time ago, and we've all heard the trope of so hard to talk to teens about things, so hard to get young people to open up. So can you give advice or maybe give some thought to folks who've tried to have that conversation, and they're not getting into that conversation with the youth in their life? What kind of things can they do to encourage that conversation?
So I'd say it's important to recognize that these are difficult conversations to have and to initiate. And when you want to have these conversations, that might be at a point at which the young person you're talking to isn't ready to share. And maybe they're still figuring out their perspectives. Maybe they feel embarrassed or unsure about what they ought to say. They may not be ready to engage when you first sort of make the offer to have a conversation. But at least by making the offer, you've established that you are open to a conversation, you want to have it, and that when they're ready, they're going to have someone who can listen receptively, share good information in a reliable and trustworthy way, and really try to help them navigate the challenges in their life. If you are to the point where you're going to have a frank conversation where they're just going to open up to you, you can try things like asking your teenager or adolescent or youth about what their life experience is. So asking them about, what's going on at school, what's going on in your friend group, when you go to parties, what kinds of things do you do or do you see? Do you see people using cannabis or other drugs? Is that something that people at school do? If so, what do you think about it? How do you feel about it? You can kind of begin to get a sense of someone's perspectives or decision making on that issue, even if they're not willing to share their own decisions they've made or open up about what they have or haven't done. You can just kind of ask about the context of their life and get to better understand that as a way to understand what might be happening.
Great. Um, so let me shift gears, but maybe ask a related question. So we know one of the key factors here in this situation is the conversation, but there's also steps parents can take before, right? So can you talk about some of the steps that we can take to increase safety in our own homes?
So, I mean, having a conversation is foundational, but it isn't the only thing. In particular, if you have substances like cannabis in your home, it's worth really making sure that you are being mindful about how you're using it, and where you're storing it. So of course, cannabis is legal, adults use it, we know that happens. But if, for example, you're using it in front of a young person, they might get certain ideas about what's normal or acceptable or promoted in that family context and develop norms around that. They also, might know they have cannabis in their home and be trying to find it. It is important to really store it away in a safe place, secure place, and to be aware if any of it's missing or unaccounted for. In particular, if you have young kids in your home and if you're using cannabis edibles, it is really particularly important, given what we've seen around things like poisonings related to edibles, that you not leave these things lying around. You store them safely out of reach of young people. As well, when it comes to things like prescription medications, ideally they should be secured safely as well. And if you have old prescriptions sitting around the medicine cabinet that are from a condition you had a year ago or 2 years ago and they've expired, you can return those things to a pharmacy. You can dispose of them safely, and that just takes them out of the home environment so they can't be used. It is worth remembering that these are things you can do within the home environment. That isn't the only place that people can access it. And even if you do everything right, or even if you're being very careful and secure, a young person still has other ways of accessing these things through school or through friend groups or family members outside the home. It isn't something that's bulletproof or guaranteed just by your actions. These are things that exist in our community.
You said something there that I think is timely with a question that just came into the Q&A, which was, can you talk about the risk? Sorry, you talked about, different families, different contexts. We know people use cannabis now that it is legal here in Ontario. And you mentioned that within your context, that's where you've learned what is acceptable. So if they're seeing cannabis use, can you talk a little bit about the risk to young people of sort of secondhand exposure of let's say cannabis smoke?
So, I mean, with a lot of things that you can vape or smoke, secondhand exposure is a concern. We know, with tobacco and cigarettes, that's been well established and understood. And whenever you put these substances in the air, people around you can breathe them in. And so it is important, if you're going to use it by smoking it or vaping it, use it, outside or away from others. And just be mindful of the fact that you're literally creating a plume of smoke or vapor that can contain psychoactive substances and other harmful compounds. And really, it's part of how to use these things safely among other people who you don't want to expose.
Thank you. You mentioned, and I want to come back to an answer you gave a minute ago. You mentioned that there's a lot we can do in terms of conversation, in terms of securing our own homes, and then you mentioned that it's not the only way young people can get access to cannabis and other substances. So can you talk a little bit about what we know about how youth are accessing some of these substances?
So we do know from survey data that a lot of youth report getting it, from friend groups. These are substances that may be present or circulated at social gatherings or parties that young people are at. That the key thing I want to make sure people come away from is a sense that even if these are not substances that exist or are present in your home or family environment, because your child or you're the young person in your life have friends, they go to school, they may participate in extracurriculars or sports or what have you, they are always interacting with other people who may have access to these things, and sharing these things is a phenomenon that we know happens. And so what I really want to make sure people understand is that that risk exists. It's worth talking about that risk with the young person and to really make sure they're equipped so that when outside the home, they're faced with a decision about whether to accept someone's offer to share or to use cannabis or other drugs, they are set up for success as best we can, so that they make a healthier option.
Great, thank you so much. I want to give us, we have time for just one more question. And you talked about this during your presentation. I really want to leave people with this one, which is, can you talk a little bit about the signs of opioid poisoning and opioid overdose, and so people know what to look for if it's someone in their life, if they're out somewhere, so that so that we all have a really strong understanding of what those poisonings look like?
Sure. So unfortunately, opioid overdoses are something that are becoming more common because of the drug poisoning crisis that we're in. So it is worthwhile for everyone to understand what one could look like. Essentially, someone after, whether they take an opioid by mouth or some other method, as it takes effect in their body and on their brain, they might become drowsy, they might be a little bit discoordinated, they might feel very tired, and their movement will slow down. You might notice their skin is getting clammy. You might notice their breathing is slowing down, and they may actually completely go unconscious. And unfortunately, one of the key things about an opioid overdose is someone who goes unconscious, they can be very difficult to rouse. Even if you shake them, you call their name, you do everything they can to get them to wake up, they are not going to respond because chemically what's going on in their body keeps them from doing that. And because of that chemical interaction in the brain, that person will slow down their breathing potentially so much that they stop breathing, which is what can kill them. And that is the thing that naloxone, the medication, can help with. It, when you give it within minutes, helps to block the effects of opioids on the brain. They will begin breathing, or they'll increase their breathing. They may even rouse or wake up. It is temporary, so you still have to call 911 and make sure they are taken to hospital or managed by emergency medical personnel. But that is what can happen with even a small quantity of opioid if it's potent enough. And we are fortunate that in our community, we do have a medication that is free, widely available, and safe that you can give to save someone's life within minutes.
And Dr. Tenenbaum, let me ask, because I believe this to be true, but I want to hear from you. There's very little risk of giving someone naloxone. So if we gave it and that wasn't what the person needed in the moment, that will actually have a very little harmful effect on them.
Naloxone is a very safe medication. We talked about drugs being unsafe, opioids or prescription medications or cough medicines if they're used inappropriately. Naloxone is a very, very safe medication. You can't really overdose on naloxone. So if you suspect, even if you're not sure, if you suspect that someone is having an opioid overdose, it's worth giving, because if that's what they're experiencing, it's what will save their life.
Thank you. Uh, Folks, that brings us to 7:59, which leaves me just a moment to thank you so much for your time tonight. This is the second in a series of what we hope is an ongoing conversation. And we really try and work with our partners at the school boards who really, really deeply care about a lot of these issues in the same way that you do for the young people in your lives. So we are in pretty constant contact with our school boards, and that's what we use to inform some of these sessions and the topics. So we hope to hear more from you on what you'd like to hear from us. But thank you for spending an hour with us on your Wednesday evening. Like I said, it will be available on our website in the coming days, and we look forward to speaking with you again on topics related to supporting youth in our community. Have a lovely evening and be safe.
Thank you.